professionals. This is Dr. Saad, and as you know, we're recording series of lecture for pharmacists who are going to appear for international equivalency exam. And in previous video which we recorded, I told you that this is our upcoming video, is our second last video for central nervous system, and we will discuss here the data which is CNS related drugs, which is a part of a group, or you can say group of drugs, which is a part of a prescription to manage the various condition of central nervous system. So let's begin our topic, that is the anxiety disorder. As you know that every person has a certain level of anxiety, and in a specific limit it is acceptable, but once it crosses or goes beyond the specific limit, then it is taken as an ailment and it is treated by the pharmacological intervention. That's why we are here to talk about it, because it affects the person behavior and affects the quality of life. So there are various types of anxiety, that is the generalized anxiety disorder, panic disorder, social phobia, post-traumatic stress disorder, and obsessive compulsive disorder. Similarly, there are many causes of anxiety. Some of organic causes are: number one is thyrotoxicosis, caffeine, and alcohol withdrawal effects. Hope we will identify the person who is he's in anxiety or not. Okay, there are some symptoms. Number one is the dry mouth, sensitive to noise, palpitation, discomfort in chest, awareness of misbeat, and restlessness, tremor, itching, GIT disturbance, breathlessness, fearful anticipation, irritability, worrying thoughts, headache, dizziness, insomnia, and and you can say avoidance of situation. These are some symptoms through which a person can be identified as either he's an anxiety person or not, or through which healthcare practitioner move for the differential diagnosis. So no point comes here once a person is being defined, once you can say anxiety is being established, then how we will use pharmacological approach. At first stage, we will use immediate or short-term management, and this management wouldn't go beyond the limit of 2 to 4 weeks. And it is being in this management we'll use benzodiazepine drugs, and we'll use alprazolam whose dose at the dose, you can say the dose which we will use is 0.5 to 1.5 mg per day. Similarly, chlorodiazepoxide will use this drug's dose 30 mg per day, and clonazepam, its dose should be within the 2 to 4 mg per day, and diazepam, its dose should be within the 5 to 30 mg per day, and lorazepam's dose should be within 1 to 2 mg. In some books it is mentioned 4 mg per day, but I will say you to go stay in the safe limit, that is the 1 to 2 mg per day. And oxazepam, that is the 30 mg, its dose is recommended for anxiety management is 30 mg per day. Similarly, in the last, temazepam, that's its dose is 10 to 20 mg per day. This is our first and immediate management of anxiety, that should be stay within the 2 to 4 weeks. Then and second step, we will move for our first line of treatment, that is inclusion of the selective serotonin reuptake inhibitors, and some of the most important drugs are escitalopram and paroxetine is a part of this second as our first line management. At third stage, there are some drugs which has a supportive evidence in the management of anxieties, whose name is whose belongs to the selective serotonin reuptake inhibitors, and its example is the duloxetine, and one of them is belongs to the tricyclic antidepressants, and its example is the imipramine, and similarly other drugs, that is the buspirone and pregabalin, quetiapine, vortioxetine, and vilozodone. These are the drugs who have a supportive evidence for the management of anxiety. So this is our prescription plan, and this is all about the management of anxiety by the use of these drugs. In short term, first line and the supportive evidence approach. So let's jump over towards our next topic, that is about the adverse, you can say, affective disorder. Affective disorder is just, you can also define it, consider as an is it's close to the bipolar disorder, because it all in a person swings between the manic stage and depressive stage. So let's talk about it. As you know, I think you get you have I think you got my point. So it's actually mood and emotional state disturbances disorder. So sometimes it is in a person is it falls in the manic state, and sometimes it goes into the you can say in a depressive stage. So there are some drugs that contribute to the depression and manic stage. Just it includes anticonvulsive drugs and antidepressive drugs and anti-malarial drugs, beta blocker, corticosteroids, HIV medications, and interferons and isotretinoin and methyl dopa. These drugs contribute to the depressive and manic disorders. So it can aggregate, you can say, stimulate the situation. So once a person swing between the depressive state, and how would in a person who is suffering from affective disorder and he's in the depressive mode, then how would manage this? We will use monoamine oxidase inhibitor drugs, and its example is the isocarboxazide and silagilene and trinylcypramine. These are the drugs belong to the monoamine oxidase class. Similarly, can use tricyclic antidepressant drugs. Its example is amitriptyline and imipramine. And we can also use these selective serotonin reuptake inhibitor drugs, and its example are fluvoxetine. Its examples are fluvoxetine, paroxetine, seroxetine, citalopram, escitalopram. Similarly, we can use select serotonin norepinephrine reuptake inhibitor, which is commonly known as SNRIs, and its example is venlafaxine, duloxetine, and ripoxetine. And there are some other drugs who out of them who's defined as the serotonin modulators, and its examples are the trazodone and vortioxetine. These are the drugs which can also be part of this depressive management of this situation. Similarly, we can also use mirtazapine and we can also use mirtazapine for the management of depression. And once there are some other, these are the pharmacological approach for the management of depression of this affective disorder, you can say bipolar disorder. We can also use electroconvulsive therapy for such type of patients. This was the all our pharmacological approach or part of our drugs which are the part of prescription for the management of depression. Then similarly, once a person in this affective disorder is in a manic stage, overactive stage, then we will use benzodiazepine drugs, and its example is again just for a review is diazepam, lorazepam, alprazolam, chlorodiazepoxide. Through this way, we'll manage the manic stage. Similarly, we can also use the valproate, semi-sodium, and we can also use antipsychotic drugs. Most probably, we use the second generation antipsychotic drugs, and its example are olanzapine, risperidone, clozapine, and ziprasidone. Similarly, in lithium has the number of medication management issues because it has a narrow therapeutic window. So we will be very careful while using lithium as a part of prescription because its therapeutic window is very narrow. So this was all about our affective disorder and its management in the manic and depressive stage. Next condition is about schizophrenia, and we don't have a very schizophrenia, as I told you in while when we was recording about its detail in a previous lecture, that it has two types of symptom, that is the positive symptom and negative symptom. So this is a condition that is not very easy to define, easy to identify, and it's require more professional approach. But just for your information, we use antipsychotic drug and cognitive behavior therapy for its management. There are some first antipsychotic drugs, as I told you. Their examples are clozapine, olanzapine, clozapine, olanzapine, ripresidone, and ziprasidone. These are some of the example of second generation antipsychotic drugs. First generation have a very high side effect profile, but second generation has two major side effects. That is, the number one is the weight gain and travel dyskinesia. We have already talked about it in the previous lecture, the how we will manage this situation. So this was all about the schizophrenia, and it's being managed by the use of antipsychotic drug and behavior therapy. So let's move on our next point, that is about the epilepsy management, and then we will this is our topic of management of the epilepsy. As you know that epilepsy is a seizure, and it require and very effective and planning for its management, because it can be, there are various types of seizure. So let's move on our topic and discuss the points. Point number one is about the individual with epilepsy and their families should participate in all decision taking, and all should agree upon the plan. This is the point number one, that all should participate and should agree upon the plan or the management of epilepsy. Point number two is about the treatment individualization according to seizure. So there are various types of seizures, so treatment should be specific for a specific seizure, a specific person. Point number three is about about its management of epilepsy, is about the for prolonged repeated seizure, or you can say convulsive status epilepticus. We will specifically use the buccal midazolam or rectal diazepam. These are the drugs which is specifically used for prolonged seizure, or you can say convulsive status epilepticus. These are the condition for which we will use buccal midazolam and rectal diazepam. And similarly, point number four is about the regular review at least once a year. These are some very key points which have to be keep in mind while addressing the person with the epilepsy. Similarly, when situation arises that there is an uncertainty of diagnosis or seizures are not controlled or failure of treatment, then immediately refer this patient for the tertiary care approach. Tertiary care. This is all about the management steps prior to implication of, or you can say, guidelines for the management of anxiety. Sorry, for the management of epilepsy. Now let's move on our treatment relevant to specific types of epilepsy. There's different types of seizure, as you know, but we will discuss them in a separate way. First one, we'll talk about the focal seizure. In for the management of focal seizure, it's a request for you to go and review both the focal seizure and its detail. So let's talk about how we will manage this type of seizure. For the management of focal seizures, we will use two-step approach. Number one is the first line treatment. That is in the drugs which are the part of first line treatment is name are its name are carbamazepine, lamotrigine, levetiracetam, oxcarbazepine, and sodium valproate. These are the first line agent for the management of focal seizure. Then we will use for adjunctive drugs. Its names are brivorocetam and clozapam, eslicarbazepam, gepantene, locosamide, and premapanol, phenytoin, you can see pregabalin, topiramate, and zonisamide. These are the drugs which you use adjunctive with the first line treatment for the management of focal seizure. Next type of seizure is generalized seizure, and it's you can say also that it's known as tonic-clonic seizure. Generalized seizure or tonic-clonic seizure. Its first line approach is again almost same, but the variation of its some drugs that is the so management of first line seizure of the generalized first line therapy of the management of generalized seizures are, as you can see, tonic-clonic seizures are carbamazepine, lamotrigine, oxcarbazepine, and sodium valproate. Similarly, adjunctive therapy for its management is clozapine, levetiracetam, and topiramate. This is the management of tonic-clonic seizure. Next is about the tonic or clonic seizure. These are the different seizures, tonic or clonic seizures. Its first line approach for the management is sodium valproate, and adjunctive therapy would be also lamotrigine, rufinamide, and topiramate. These are the adjunctive therapy with for the management of tonic or clonic seizure. Side by side, the first line approach, that is the sodium valproate. Now, third type comes, that is the absence seizure, and its first line management is the drugs which include in its first line of management is ethosuxamide, lamotrigine, sodium valproate, and its adjunctive therapy or adjunctive drugs or you can say associative drugs include clobazome, clonazepam, levetiracetam, topiramate, and zonisamide. Clobazine, clonazepam, levetiracetam, topiramate, and zomethadone. These are the drugs which are the part of a neurotherapy for the management of absence seizures. Side by side, the first line approach, that is the ethosuxamide, lamotrigine, and sodium valproate. I'm repeating because you can easily memorize this because these are the very important part of the management of this condition of absence seizure. Next is the last type of seizure, that is defined as the myoclonic seizure. And for myoclonic seizure, it is recommended to use levetiracetam, clonazepam, and sodium valproate, topiramate, ziprasidone, and piracetam. These are the drugs which is specifically used for the treatment of myoclonic seizures. So there are some drugs which are common in the pharmacy. So let me mention you the doses for the management of specifically seizure. Number one is drug is the gabapentin. Its starting dose is 300 mg, and it can be used between the 1800 mg to 3600 mg per day. Locosamide's starting dose is 50 mg, and it can be used between the range of 200 to 400 mg. Lamotrigine, its starting dose is 25 mg, and it can be used between the dose of 200 to 400 mg. Similarly, levetiracetam's dose is 250 mg. The starting dose is 200 to 250 mg, and it can be used between the range of 1500 to 3000 mg. Pregabalin's starting dose is 25 mg, and it can be used between the range of 150 to 600 mg. Sodium valproate's starting dose is 500 mg, and it can be used between the range of 1000 to 2500 mg. And similarly, in the end, topiramate's starting dose is 25 mg, and it can be used between the range of 100 to 500 mg. So this is all about the management of epilepsy, and in upcoming video we will talk about those two topics: number one, the Parkinson's disease and the dementia, and then we will also begin our next topic, and we will choose the topic. Most probably we will talk about the endocrine disorder, and you can say we will start the endocrine system. And this is all about today's topic, and I hope I use minimum time. I am very sorry if I use more time, because our target was to use minimum time and cover maximum point to provide you data. It is a specific request for you all professionals to go to listen to my video side by side, stay in contact your stay in contact with your devices, and go and search about the drug, its mode of actions and its side effect profiles. When I talk about some condition, go and search about that condition, see videos relevant to that, and just grasp them. Then once you get a concept, then close our videos, everything, then properly write a prescription. Because once you write a prescription and keep on writing, this practice will make you more perfect and will make your mind sharp for the management of a drug for the various condition. Because medical science is not so easy. So once you will go out of practice, you will definitely forget these things. I know you will easily recall them, but once you wouldn't stay in a practice, it would went out of your mind. So thank you so much for listening my video, and if you feel that our this effort is an effective for you and it is helpful for you, then please subscribe our channel and share our channel with your friends. Thank you so much.